So today we'll be talking about the Hanta fever, also known as the Hanta virus. It is a pulmonary syndrome that presents as pulmonary edema, hypoxia, and hypotension. It also presents in different ways depending on the disease state that you have, but we'll get on into that a little bit later on. Hanta fever is commonly found in the southern part of the United States, but not really the southern part, also found in Europe and Asia. The virus itself is a single-strand RNA virus that is made up of RNA-dependent RNA polymerase, a glycoprotein precursor, and a nucleoprotein. Talking about the different disease states, HPS and HFRS are both caused of the orthohantavirus genus in the Hentaviridae family. The infection starts by a human inhaling aerosolized rodent urine, droppings, or saliva. Yay. Once the rodent excreta is inhaled, the virus infects the endothelial cells of the lungs, which is found in the HPS, or the kidneys for the HFRS. Along with that, epithelial cells, dendritic cells, and lymphocytes are also impacted and play a key role of causing this disease state. The hantavirus starts off by, once it enters the body, by sticking its viral glycoprotein into the cell's surface receptors. The immature dendritic cells are then act as carriers for the virus through the lymphatic tissue. Viral replication continues through the lymph nodes, regional lymph nodes, where the dendritic cells carry them through that tissue. The hantavirus induces the maturation of the infected dendritic cells. The maturation of the dendritic cells elicits a T cell response in the acute phase of the infection. So once it hits that T cell response, the exposed endothelial cells activate an immune response triggering macrophages and CD8 T cells to come to those infected endothelial cells. The invasion of the endothelium induces interferon alpha, which causes the prodromal manifestation of the disease. The viral RNA causes a cytokine storm, which increases levels of TNF alpha, IL-6, and interferons, causing the organs to become inflamed. With the CD8 T lymphocytes being triggered, the immune cells attack the endothelial cells, increasing the vascular permeability to increase. The damage to the endothelial cells causes plasma leakage due to the vascular permeability to be being increased, which causes plasma to leak from the surrounding tissue, and this is known as capillary leak syndrome. With the capillary leak syndrome, the lungs and heart and the HPS are impacted, and in the kidneys are impacted in the HFRS. This causes the symptoms that we see in hantavirus to present. All right. In the difference between HPS and HFRS, HPS is known as Hanta pulmonary syndrome, which causes leakage in the pulmonary capillaries, which is two major differences. Symptoms for HPS, symptoms begin around 1 to 8 weeks after coming in contact with the infected rodents specimens. The main cause for HPS is actually deer mice, not really any other rodent, because HPS is specifically found in the United States. It's commonly found in New Mexico and Colorado, and deer mice are apparently really popular there, so you'll get infected by their excreta. The virus specifically deposits into the alveoli and the terminal branches, which trigger alveolar macrophages, which cause the infection to spread to the endothelial capillaries, the pulmonary capillaries, and the endothelium, along with what we talked about before. Not only are the lungs impacted, as I said before, the heart is also impacted because the capillary leakage, the plasma starts to leak from the lungs to the heart, which causes hypotension and bradycardia and thrombocytopenia also occurs, which can cause hemorrhagic complications, also known as internal bleeding, which internal bleeding is not one of the big issues, surprisingly, in this case, but does not help the situation. Symptoms to tell if you have HPS are fatigue, fever, muscle aches. Really great symptoms to look out for. But after 4 to 10 days of being either inhaling or bit by a rodent, patients will experience shortness of breath, chest tightness, and coughing. Also not the greatest symptoms to look out for. But for hemorrhagic fever with renal syndrome, also known as HFRS, the major difference is the leakage occurs in the renal tubules. Symptoms also occur a lot faster. Symptoms normally occur between 1 to 2 weeks after exposure, but if you're unlucky, they occur 8 weeks after. Very rare though. Symptomatic HFRS progresses in 5 stages. The febrile stage, hypotensive stage, oliguric, polyuric, and convalescent. Symptoms present as a headache, a fever, backache, nausea, vomiting, and abdominal pain, which makes sense because it's impacting the kidneys. Acute kidney failure can occur in patients due to the fluid overload since the plasma is leaking and your kidneys are not working how they're supposed to work. It is common for proteinuria to occur, so protein in the urine, and also blood to be found in the urine. I don't know if I've said this or not, but it is commonly found in Europe and Asia. There's no really difference between what rodents infect you. Just stay away from the rodents, I guess, over there. Okay, time for the disease spread. Hantavirus is obviously, as we've been talking about this whole time, through small reservoirs, aka rodents. Rodents such as bats, moles, shrews, reptiles, and fish, also mice. Hantavirus is a naturally occurring infection in rodents that they contract early on in life and remain asymptomatic. The virus does not actually impact the rodent, it more or less coexists, so it has I don't want to say cute symbiotic relationship, but it's a symbiotic relationship and it doesn't actively harm. They just use rodents as a vector to infect humans. Yay. Infection, mainly the main way for humans to contract this disease is through, if you're cleaning out a barn, you're sweeping up the hay and like the chips that you put for bedding down, rodents will either pee or poop in the bedding, go to sweep it up, becomes aerosolized, breathe it in, you got Hanta fever. But if you're lucky, you can be bitten by a rodent and get the disease too. It can also occur by touching rodent pee or poop and rubbing basically your eyes, also known as mucosa membrane, or through, if you touch a cut, it will enter that way too. Just really wants to enter your body, I guess. Now, I don't think anyone keeps their food intentionally near rodents, but you can get it through contaminated food and water as well. So that's great. Transmission from person to person has rarely been heard of, but in some research it did say that it can be transmitted through mother to child through breastfeeding. So that's great. Um, that's all I have. I hope this was interesting for you.
As we heard from Ashley, the hantavirus can cause two major diseases, the hemorrhagic fever with renal syndrome and the hantavirus pulmonary syndrome. Unfortunately, when it comes to the hantaviruses, there is no specific cure or treatment. When looking at the hemorrhagic fever with renal syndrome disease, or HFRS, the standard of treatment here really is supportive care, and it is very critical that this supportive care be started as early as possible due to the fast progression of the virus. In this instance, there are a few main priorities and values to monitor, and one of those are hydration levels. Hydration levels are important to monitor here as throughout the progression of the virus, electrolyte imbalances can occur, and those imbalances can lead to other conditions such as hypotension and hypovolemia that we would want to look out for. Oxygen levels are another vital that should be managed and monitored. Monitoring oxygen levels is important as the hantavirus can cause cardiovascular and respiratory complications. We would also want to be cautious and treat to prevent any new infections from forming that are secondary to the hantavirus. And in some severe cases, or ending the progression of the virus stage, implementing supportive care such as renal dialysis may be necessary, as the virus can disrupt kidney functions such as filtration rate. It can cause inflammation of the kidneys and potentially even renal failure. As stated before, there are no specific treatments when it comes to the hantavirus. However, there is currently some ongoing studies being done centered around the drug ribavirin. Ribavirin has been used in some parts of Europe and in Asia to treat hemorrhagic fever with renal syndrome, with some cases actually showing effectiveness in successfully treating the disease. As of now, ribavirin is not currently FDA approved to treat hemorrhagic fever with renal syndrome in the United States. The ongoing study that is happening now is being done under the CDC. So hopefully that study can be done to help determine if ribavirin can be effective in treating hemorrhagic fever with renal syndrome in the United States. Due to the nature of the study still being ongoing, there has not yet been a determined standard dose or treatment plan in using ribavirin to treat this disease. And there has also not been any determined contradictions yet in specialty populations using ribavirin to treat this disease. Currently in the United States, ribavirin is used to treat other conditions such as hepatitis C and respiratory syncytial virus, also known as RSV. The drug does have some contradictions in both of those treatment plans. Those contradictions are in specialty populations such as those who are pregnant and or lactating and children. In those who are pregnant, ribavirin is contradicted. This drug does have some teratogenic properties and is pretty much just deemed unsafe in those who are pregnant. Interestingly enough, these teratogenic effects are seen in both male and female patients and are therefore contradicted in even couples who are not yet pregnant but trying to be. Both the male and female partners should avoid ribavirin in these cases. In those who are lactating, ribavirin has its safety is unknown in this scenario, so yeah, the side effects in those who are lactating are unknown. It's not known if it's contradicted. In children, ribavirin is rarely used for treatment of any kind because of its side effects as well. Some of those risks include growth impairment, anemia, and birth defects. While the study for ribavirin in treatment of HFRS is still undergoing, I would like to say that it would, based off of other contradictions and other diseases, it's probably not going to be safe for those who are pregnant, and most likely not used in children. When we're looking at treatment for the hantavirus pulmonary syndrome, its treatment plan is the same or similar to hemorrhagic fever with renal syndrome, in that being supportive care is the standard of treatment. And again, early intervention and intense supportive care is definitely crucial for a favorable outcome. Supportive care here with hantavirus pulmonary syndrome still includes monitoring hydration and electrolyte balance. Definitely still monitoring the oxygen levels as this coincides with respiratory conditions, as well as monitoring cardiac function is very important here. And in some severe cases, intubation and ventilation may be indicated here. And again, ribavirin hasn't been studied, but also is not indicated for treatment of hantavirus pulmonary syndrome, even in other countries. So my guess would be after the United States investigation, it's most likely not going to be indicated for treatment of this disease as well in the United States. Now I will go ahead and pass it on to Taylor, who can run you through preventative measures for hantavirus.
So for the prevented prevention measures. One of the thing that was listed was rodent control, which is eliminating rodent food sources inside and around the house, seal holes, cracks, and other openings to prevent rodent entry, use traps to capture and remove rodents, clear away debris, clutter, and vegetation that could serve as a nesting site, environmental safety, ventilate the room and enclosed spaces before entering, especially if rodents may have been present. Avoid sweeping or vacuum areas with rodent droppings, urine, or nesting materials to prevent aerosolization. And then for personal protective measures, wear rubber or disposable gloves when cleaning rodent infested areas. Use disinfectants, for example, bleach, to clean contaminated particles. And then this is just a picture that I found on how to prevent hantavirus. So seal it up, which is sealing all types of like food and that kind of stuff, or like baking supplies, and then trap for rodents. So like mouse traps, bug traps, that kind of thing, and then clean up, which is using with the bleach and that kind of stuff. Vaccinations are currently not um, in the United States for this virus, but the first generation is inactivated, which is HTNV, SEOV, and it's a baseline protection and it's only offered in Asia. There is a second generation, which is VLPs and recombinant proteins, and they're longer lasting immunity, and it's currently in the preclinical stage. The last one is a third generation recombinant vector and a DNA vaccine. It's broad and durable immunity response. The first one is currently in preclinical slash discontinued, and the second one just completed its phase one. So those might come in the following years. And then all of our references that we used for our slideshow.
Now, something else we wanted to share with you is actually somewhat of a recent case of the Hanta virus in the United States. This case does involve, or did involve, the actor Gene Hackman's wife. Her name was Betsy, and back in February of 2025, she was found passed away in her New Mexico home. Later, it was determined that her cause of death was actually from the hantavirus that formed into the hantavirus pulmonary syndrome. Unfortunately, her husband, actor Gene Hackman, was also found passed away in their home, but he actually passed away from heart disease. So the overall story is very sad, but the reason we wanted to add it in was because it did gather some traction regarding the hantavirus, and got the media's attention. We did end up finding a Fox News clip that provided a nice summary of not only the Hackman's case, but also some important information regarding the hantavirus. This video included things such as a little bit of history of the hantavirus and some places that involve more risk exposure than others. It also involved providing some preventative measures to take for those who are in more high risk areas. In the Hackman's home, they, like I said earlier, were located in New Mexico, and New Mexico does have a rather large population of a common vector in the hantavirus, and that is the deer mice. So it does go over, this Fox News video does go over some measures to take when battling those vectors. We'll go ahead and play that for you here shortly, and we hope you enjoy the video. Thank you.
Gene Hackman and wife Betsy Arakawa. We thought it was important to address the cause of Arakawa's death. Hantavirus, though rare, is highly infectious to humans. Let's welcome Dr. Joel Montgomery, Director of the Division of Health Consequence Pathogens and Pathology at the CDC. So glad that you could join us. Thank you for being here.
Thanks for having me.
So Arakawa's death was determined to be hantavirus pulmonary syndrome. This is a rare case, is it not?
It is rare in the United States. This virus actually was first discovered here in the United States back in 1993. So we've known about this viral infection and this virus for actually several years. It is actually transmitted from rodents to humans, which would happen in this case, actually. But it is rare. Since we've been working on this virus, and the discovery in 1993, there have been over 900 cases identified in the United States.
Wow. And I think it was very shocking that this was such a high-profile case involving hantavirus. How exactly is it spread? And you mentioned rodents. Is there one particular type of rodent? Is it multiple types of rodents, species?
Yeah. It's a really good question. Actually, the more we study this virus, the more we learn about the different rodent reservoirs, if you will, the different species of rodents that transmit this virus. There are some primary species. The deer mouse is the primary reservoir for hantavirus, but we do know of other rodents that do transmit similar hantavirus. There's a variety of different species of hantavirus. But it is widespread throughout the United States. We see the majority of cases in the West. It was first discovered in the Four Corners, so Colorado, New Mexico, Utah, Arizona is where it was first identified.
And why is that?
But it's transmitted.
I'm sorry to interrupt you, but I'm curious because I've read
it's-
that it's west of the Mississippi is where it's most prevalent, and you mentioned the Four Corners. Why there in particular?
Right. Yeah, it's because of the species of rodents that carry it. They're predominantly found in that region of the United States. But as I mentioned earlier, the more we study this virus, the more we realize it's more widespread throughout the US, because there are different species of rodents that transmit the virus. But the deer mouse, the primary vector or reservoir for this virus, is primarily found in that area of the United States. And again, it's rare, relatively rare, but the more we look, the more we find. And when you have high profile cases in this instance, it does elevate, I think, the information that's out there. People are more aware. The symptoms in the early stages of hantavirus are very nonspecific. So fever, flu-like symptoms. So you may think you have the flu or COVID or some other respiratory illness, and then it just progressively gets worse. The case fatality rate or the likelihood of dying from infection with hantavirus can be as high as 40%. So it's quite fatal, much more fatal than, say, influenza or COVID.
And how is it transmitted?
So it's transmitted from the rodents to humans, primarily through contact with their excreta, so urine, feces, saliva. So typically what happens, and this is 9 times out of 10 how people get infected, they'll go out to, say, an outbuilding, a shed or something out, and they'll sweep the floor where there's rodent droppings, urine. The virus is very stable in the environment. And so once the virus leaves the mouse through feces or urine, it can dry and it's still infectious. So when you're sweeping a floor, it aerosolizes the virus and you breathe it in. It gets into your eyes, your nose, you breathe it in, you get infected. So that's why our recommendations are when you're cleaning out buildings that is known to have rodent infestation, you should wear an N95, protect your eyes, and better actually, you should spray bleach and disinfectant on any droppings or urine that you see that have been left behind by rodents.
That was going to be my next question. Yeah, if there's something that you can do sort of and is there anything that you can do as a prophylactic to prevent the mice from being in that spot? I mean, obviously there's rat traps and things like that, but is there anything maybe more chemically speaking that you can apply to those outbuildings that would repel them?
Yeah. So typically, like you said, use traps. What we recommend is if you can at all, prevent rodents from coming into those buildings. So seal up holes or any areas they may be able to get through. Open windows, make sure they're closed. Fill up any holes, rat traps, and then if you need to, also you can call your local exterminator to help prevent the incursion of the rodents.